to school, but one thing they hope to leave behind, the dreaded freshman 15.
Absolutely, and with a growing obesity epidemic in our country, experts say teenagers need to arm themselves with a game plan to stay healthy.
After a semester, I probably gained around like 10 pounds.
Annalisa Curry is talking about her first year in college. Studies find 70% of college kids pack on an average of 12 pounds in the first semester, part of the nationwide escalating obesity epidemic, with 40% of Americans now obese.
It's huge. You know, everybody wants to lose 1 or 2 pounds or 20 pounds or 100 pounds. You know, people just aren't satisfied with their weight.
Huntsville Hospital dietitian Linda Stakely sees a trend with today's collegiates.
I think all of the eating out that our society is doing is really making the problem of being overweight much, much worse.
Nutritionist Samira Khan, the best-selling author of Regain Be Gone, counsels people about weight loss surgery on how to keep it off. Now up to a third of her clients are young and looking for surgery, saying their weight gain started in college.
It's at least 10 to 20 pounds per year. It used to be with grandparents, like people in their 60s going for the surgery, and now we see the parents, 30s, 40s, and then women in their late 20s who want to get pregnant, who are unable to get pregnant, because as soon as you lose a tremendous amount of weight, your fertility level goes up, so it's easier to get pregnant.
My biggest temptation was the fast food and chains, and then it does kind of, you don't want to say no when your friends invite you out.
Annalie managed to shed those pounds this summer. Now she's arming herself with an app to keep them from coming back. But which one? A dizzying array promised to keep the bulge at bay, but can cost anywhere from $2 a month to $30, even $50 or more monthly.
I just was really shocked that these services were ranging so much. I tried looking if the features were different, but they weren't really that different.
Even worse, Annalise says the apps made it hard to know just how pricey they really were.
I had to actually download the app, create an account, and then see their rates from there.
She mapped out her findings and eventually settled on LifeSum at $2 and change a month, tracking her food intake, exercise, all with some encouraging feedback. Essential elements for success, says Khan.
They need that motivation, they need consistency, and they need discipline, which the app should be providing.
And Stakely warns clients, whatever app you choose, use it correctly.
I always tell patients, those apps may or may not be accurate, and it depends on how accurately you put the food into the app. And just don't rely on it. It's a good way to write it down.
But don't make it the end-all be-all for tracking the habits that can change your life.
Obesity is an inflammatory disease, so that leads to diabetes, heart disease, and hypertension. We see a lot of hypertension, we see a lot of PCOS and infertility in females, also because of the weight gain.
So while your app choice may not be life and death, your health journey is. Siobhan Bryan, WHNT News 19.
One recent study shows 70% of college graduates gained 37 pounds by the time they got their diploma. Some wellness apps like MyFitnessPal offer a free version, but the cost comes in when you choose to access some of their premium features.